Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about the difference between an iOS and a ClinCheck export. Two totally different things. Doctors get confused, but most often or most commonly patients get confused as to what they're looking at and what it means. So if you go into your doctor's office and you're getting maybe psyched up for Invisalign and you get scanned, and the machine will look something like this thing right here. If instantaneously you see your teeth on the computer screen and a little bit of like a little setup as to what your smile might look like, that is an iOS or Invisalign Outcome Simulator. It's just the AI that's built in the software, and it's kind of just showing you how your teeth might look nicer according to the computer. It doesn't mean it's exactly what your doctor's gonna do. It's exactly how many aligners it's gonna be. It's just a rough estimate. Kind of pretty, right? That's something you get at that appointment. That's completely different from a ClinCheck. Now, your doctor doesn't have to have an ITero scanner in order to get a ClinCheck. You might take impressions. You might use another type of scanner. You might use an ITero scanner. Lots of different ways that you can get the information. All that information is uploaded along with some photos and maybe an x-ray into the Invisalign software. Your doctor will communicate with their technicians to get a detailed setup of exactly how they want to move your teeth, how they move, how they tip. And there's a lot of artistic skills that go into designing a ClinCheck. A really good orthodontist or dentist might take 2, 3, 4, 5 go-rounds to get this right. Each go-round is going to take a few days. So it usually takes maybe bare minimum 1 week if there's a scan to up to 3 or 4 weeks to get a really good ClinCheck done. This is not something you're going to have at that first appointment. It will take a few weeks. Now, most commonly, some doctors will call the patients in, or they will export the ClinCheck to the patient. There are ways that you can send it just through email. It's a bit of a process now. It's changed a lot. So most recently now what will happen is your doctor will put your patient information in, including your email, your phone number, your name. You'll get an alert saying there's a ClinCheck ready for you to view. You will click on it, but you will have to also download an app and put in some personal information and some codes and other things in order to be able to view it. Once you view it, it will not have your name on it because it has to be HIPAA compliant. It'll just be a simulation of your teeth. You always want to see your ClinCheck before you agree to do treatment. Matter of fact, it costs the doctor not a penny in order to be able to set up that ClinCheck. It takes their time, which has a value to it, right? And resources, which has a value to it, but it doesn't cost them any dollars. So I always strongly recommend that you do not put a single cent down, no matter what they tell you need to do, because you know you don't need to, until you see that ClinCheck. Because I think the biggest mistake, and matter of fact, shop around. Because you know what? If your doctor is as good as they say they are, you will love the ClinCheck. And your doctor will take your feedback. You know, I don't love the way tooth number 10 looks. I'd kind of like it a little more rotated, or, you know, can the teeth come a little more out, or can they go a little more back? They even have a facial recognition feature where they can put the teeth on your smile and you can see what it looks like. It's really sophisticated and it's really cool. And a really good doctor will want your feedback on the ClinCheck. They will want to know what you think, and they will want to know if you have concerns. It'll also show you how many attachments you need, where the attachments are. It'll also show you if you need interproximal reduction and where it'll be and how much. It'll show you if you need rubber bands and how you'll wear them, how many rubber bands you'll need, how many aligners you'll need, and lots of information. So again, I want to emphasize, you should always ask your doctor to export the ClinCheck to you. It is something that will happen through email. You can't just click on it. You're going to have to put in some personal information, and your doctor will also have to give you your case number in order to do it. But you should always view it and accept it. It is not required, so it's something you'll have to most likely ask for. It's not going to just happen unless you ask for it, because if a doctor doesn't have to take that extra step, they would rather you just get going, and they may think that you don't care. So if you care, ask. All right, hopefully that was helpful. Thanks.